I'd like to welcome everyone to Dental Health Professionals YouTube channel for this COVID-19 update number one on April 12th, 2020. We're probably going to have a little more or more frequent updates for you on our channel, and I want to welcome you, and we'll go through our first training video. So first of all, this is a time unlike any other that we've experienced individually and certainly collectively. And as it's Easter, I hope and wish that all of your families are doing well. We wanted to take the time to let you know that our staff and families are so very important to us here at Dental Health Professionals. This has been a very difficult time. A lot of uncertainty and emotions are running through everyone's minds, and I just wanted to say from all of us that there will be better days ahead. They may be different days, but there certainly will be better days ahead. And part of what we're trying to do is get out some messaging to you all and talk about what we're doing currently with an understanding that this is a rapidly evolving situation. So we'd like to discuss today a bit about how patients are contacting dental health professionals during this unusual time. There's been some interim guidance set forth by the American Dental Association for triaging patients for emergency and urgent dental care. And then we're going to just discuss our process of pre-screening patients, screening them, and then following up with them. There will be other videos to follow, but we want to just get this framework started for you. So currently, how do patients contact dental health professionals? And thank you, Dr. Shell, for being our model here. So by and large, during our normal daytime hours, patients can call dental health professionals and the phone will ring through. One of the things we're trying not to do is have our doors open for people to walk in. So we'd like people to continue to call dental health professionals during the daytime hours if they have any questions or emergencies or for any typical business. Now, our normal hours vary by day. Sometimes we have people there from 8 to 2, but we certainly have a phone service that's set up so that when there isn't someone there to answer the phone physically, it provides the after hours number. So Dr. Shell has this new iPhone here. It says DHP after hours phone number. That number is 231-884-8165. And we use that number quite a bit. We actually are doing some screening of patients. So even if they call during our normal daytime hours, this phone is designed to be able to have patients send us some images for something we call teledentistry that we'll discuss in a later video. But a lot of times, patients can take a picture of the condition or concern that they have and forward that to the after hours phone number. And there's always a doctor with the phone and the iPad that will be able to kind of field that inquiry or take a look at the image and get that sent off to the appropriate doctor. So sometimes the patient's calling during the normal quote-unquote daytime hours. We're still going to be using this after hours phone number quite a bit to be able to have images sent to that phone number and onto the appropriate doctor, and ultimately to have these images be found back in the patient's chart. So patients aren't perfect photographers, but we've got some pretty good examples of some images on the right-hand side. This happens to be a pretty good intraoral image of some broken teeth here. And one thing that we've been asking patients to do is make sure that they use some pretty good lighting. So these phones are pretty powerful. You guys are excellent at taking your selfies and other images, but try and encourage the patients to use a flashlight or some other type of additional lighting and have someone take a picture of whatever they have going on. These pictures are very, very important to us for documentation. This is an excellent photo of a patient of mine. She actually sent about 6 photos. She had some concerns about some swelling with her wisdom teeth. And this image really helps to see that we have no difference between the right side and the left side. She took a number of different images that were very, very helpful for us to assess, does she actually have extraoral swelling? And as we alluded to, this is a piece of information from Delta Dental of Michigan from March of 2020 that talks about teledentistry. Now, we won't get into it too much, but essentially, many of you have been receiving information from your physicians that has changed the way that they're going about their office visits. And dentistry is no different. So Delta Dental and the vast majority of other insurances have put out some information on how we can triage and manage patients via teledentistry. And we'll get into that a little bit later. So mainly what we want to talk about today is the American Dental Association Interim Guidance for Management of Emergency and Urgent Dental Care. This was updated the 1st of April 2020. There are 3 different algorithms that we're using to determine how we manage emergent care. There's no pop quiz. I'm going to have these documents available in a variety of formats. They'll be on our Facebook staff page you can download. They're actually laminated at our Horseshoe front desk area. But we're going to go through this and just give you an idea of what the framework is to work with. So let's take a closer look at this document. I don't want you to be overwhelmed by this, but essentially, when we get a patient who's contacting our office during this time, we're really focused on, are you experiencing dental pain? Okay, that question, once you've determined who the patient is and got a little bit of background information, we're going to walk you through this framework. So the question you'd say is, are you experiencing dental pain? And we're going to follow down the right-hand side. If the answer was no, I'm not experiencing dental pain, then the next question you're going to ask is, are you experiencing uncontrolled bleeding? That'd be a bit concerning. So if the answer was typically no, you would follow up with, do you need any of the following? Suture removal, denture repair or adjustment prior to medical treatment due to trouble eating, dental treatment required to medical treatment such as radiotherapy, biopsies, final crown or bridge cementation if the temporary restoration is lost or broken. And if the answer there was still no, which is quite likely, we would consider this type of care to be routine or non-urgent. Then we would delay appointing these patients until further notice because we have to have some more information from our state and local governing bodies to determine when we can open. And folks, we don't know when we can open as normal right now. We're hoping that we'll get more of a clear picture in the future, but at the moment, this type of treatment, which is actually the vast majority of things that we receive phone calls about, would be delayed with no set time. That can be very frustrating to the patient. However, these are the rules we have to follow currently. If we back up there and we see that the answer to these questions was perhaps yes, we're going to visit a second algorithm that's going to deal with screening to identify COVID-19 infection for emergency and urgent dental patients. So we'll get to that in a minute. So we've gone down the route of no pain and no uncontrolled bleeding. There, of course, would be the very rare time when you might have, yes, I'm having uncontrolled bleeding. That's going to take you down a very different pathway that goes into emergent care. Okay? And that still takes you to algorithm 2. So if back at the very first question we ask is, are you experiencing dental pain? And the answer is yes. This actually is common as well. Have you experienced trauma is the next question. If the patient has experienced trauma involving facial bones, airway obstruction, obviously that's an emergent situation, and we would probably be referring them to the emergency department. This is going to go a little bit upstream of us as dentists. But if the trauma is just dental only, think of this as being someone who maybe has had, a tooth knocked out or some injury that way, which we have had from time to time. We consider that urgent care, okay? We're going to go back down into algorithm 2. So these would be people with severe dental pain from pulpal inflammation, pericoronitis or third molar pain, like we were looking at with the images previously, dry socket, abscess, tooth fracture resulting in pain or causing soft tissue trauma. Not a tooth fracture that is just a little bit rough or is annoying or is an aesthetic emergency, but actually a tooth fracture resulting in pain or causing trauma. Dental trauma from avulsion or luxation, these are the children or adults that have had an injury. Final crown or bridge cementation if the temporary restoration is lost, broken, or causing gingival irritation, and a few other things, okay? So one of the things that we may have is patients may have a fever and swelling on the side of their face or mouth, and we're going to look at how we deal with that. But most of the time, patients are going to say, I have pain, I have not experienced trauma. We're going to want to know, what's your pain level on a scale of 1 to 10? This is actually built right into our questionnaire. And those patients that are in arbitrarily 6 through 10, severe intolerable pain, are going to become urgencies. Those patients where it is mild to moderate, we're going to be asking if they can manage at home for 2 to 3 weeks. And if the answer is yes, we're trying to delay scheduling these people until further notice. If the answer is no, they also become urgencies. So this takes you through algorithm 1. And no, there's not a pop quiz. I just went through this to help you understand how it works. It's going to be, as we said, accessible to all of you. Algorithm 2. So this algorithm is to screen and identify COVID-19 infection for emergency and urgent dental patients. And again, this is something that we'd like to do in advance of having patients come to the office. So, does this patient have a fever? And if the answer is yes, are they, and this patient is someone you're screening on the phone, we don't want to see the patient, okay? If they're having a fever, we really aren't looking to see that individual unless we had very strong suspicion that their fever is related to a dental condition. It's very different if the patient presents and we can check their temperature, but we still want to actually ask if they have a fever before they present to the office, okay? So if you have a fever that is of dental origin, that's typically something that's going to be seen by our oral surgical colleagues or is going to be seen by our endodontic colleagues, and usually those are fairly advanced facial space infections that we don't manage in our office. So typically, if we have a patient that has a fever at this point in time, we're not going to be treating them, okay? If the patient doesn't have a fever, which is most common, we're going to ask the patient if they have signs or symptoms of an acute respiratory infection. If they do, we are not going to be seeing them. If they don't, then we're going to talk about seeing these patients in the dental setting, okay? So we're really trying to screen out patients with respiratory infections, even if we don't think they're related to COVID-19, or patients with fevers, okay? Algorithm 3 is to minimize the risk of COVID-19 transmission for emergency and urgent dental patients and healthcare professionals. So, these patients are emergency and urgent dental patients that are asymptomatic, have no known COVID-19 exposure, or have recently undergone testing and do not have COVID-19 infection, or have been proven to have recovered from COVID-19 infection. Now, we'll talk about those individuals perhaps at another time. Is this patient scheduled for an emergency in-person appointment? So some emergencies can actually be managed pharmacologically or via teledentistry. Some need to be seen in the office. So if the answer is this patient is going to be seen at our office, we have to determine, is the care we're going to render generating an aerosol? And almost everything we do in dentistry generates an aerosol. And if the answer is yes, so we're going to spin a burr, or we're going to extract a tooth, or we're really going to be doing almost anything, then we're going to follow this pathway down here. And you and your staff are going to have N95 respirators fitted to our face, full face shields, and basic clinical PPE. So N95 respirators are a different type of mask. Now we're going to be calling them by their proper name, respirators, because there's going to be some training that we have to use for these N95s. You're prepared to follow approved disinfection procedures immediately after this in every procedure. So if we have screened our patients well and determined what is an emergency or urgency that is necessary to be treated in the office, then we're looking at our risk. So the risk of transmission to the healthcare provider and patients would be low. We wouldn't need a 14-day quarantine, and we could go ahead and treat that patient. Some of the other ways we can get through this algorithm take us into less comfortable positions. Now, it might be the patient or it might be our level of PPE. So if we have under our usual operating of about, say, February, we had surgical masks and basic clinical PPE, but we would have been considered to be at moderate risk, even with our level 3 masks. This is one of the reasons why we've gone to the KN95 or N95 respirators, okay? But we were deemed to be at least at moderate risk under those situations. And potentially in other scenarios, we could have been at moderate high risk, okay? Some of those scenarios might require a 14-day quarantine. So this is one of the reasons why we want to make sure that the algorithms are followed, because we want to keep both our patients and our staff members safe, okay? So one other thing that we're going to look at is this moderate to high risk at the end here, because it's not just what we're doing at the time of treatment that matters. Didn't mean to back out that far. So there's this concept of pre-screening, screening, and follow-up. It's not exactly what we're used to doing. We're used to having appointments set up, greeting people, maybe even shaking their hand, catching up with them, and seeing them out when we're done with our procedure. And that unfortunately isn't the way that it's going to be working. We have to do what's called pre-screening. So pre-screening and triage of the patients is the absolute most important step. So it's far better to manage potential COVID-19 patients ahead of time rather than rely on the quality of our PPE and disinfection, okay? So this process takes some time, and this is where we use the algorithms that we just went through to guide the process. Now, when does this occur? It usually should occur 1 to 2 days before treatment. So we don't have the ability right now to have walk-in emergencies. It just isn't something that we're doing. As a matter of fact, we have the doors to the office shut typically, and patients who would just present without an appointed time are going to have to call, and they're going to have to go through this screening, even if they're standing outside the front door. So what we'd like the front staff to do, or anyone who's answering the phones during our normal operation, is to gather sufficient information to allow the doctors to go through these algorithms. Now, sometimes you might find that something's fairly trivial and it's very easy for you to sort of make that call about, is this a patient we're going to be seeing right now? That's great. We just really want you to gather enough information to convey to the doctor of record. So you're going to contact the doctor of record about the patient, and that of course takes a little bit of time. And then that doctor is going to make the determination of what's the most appropriate step forward. And those steps forward can involve a delay of treatment, as we mentioned. Some of this is just designed to buy us some time until we know more about COVID-19 infection, know about community spread in our environment, and just until we've got things a bit more figured out here. The other option would be teledentistry. So you've seen some examples of the photos that we've included here, and some things can be screened and interactions can occur between the dentist and the patient without actually seeing them. It can be done via FaceTime, via a number of different apps, or just even phone calls. There's been some relaxation of our HIPAA compliance right now during this time. It's been approved. And then the third outcome could be treatment. So if the patient really needs to be treated and we can do it safely, then we're going to make arrangements to do that. It doesn't typically happen as quickly as we're used to. We're tending to batch a few patients together, but it's just the way that we have to get things done currently. So screening. Screening is going to be conducted when the scheduled emergent or urgent patients present for treatment. So we have our typical COVID-19 screening, which is a lot of the repeat of what we're doing in our pre-screening. We're of course going to be asking them about presence of fever, respiratory symptoms, things like that. But because we're on a bit of a delay, we're going to be re-asking them some of the same questions because things are evolving rapidly. Now, we have a new thermometer, and this is the thermometer. What it looks like happens to be sitting on top of the algorithm. Hi, everybody. everybody. I just wanted to show you the new thermometers that we have. First of all, we have the user's manual, and it's pretty straightforward, okay? This is how you get to the batteries. There's a trigger, the display panel, and the infrared portion right there. So what you're going to do is you're going to just basically pick it up, pull the trigger, and be within 3 to 5 centimeters of someone's forehead. So we're going to use William. He's going to be our model today. Come over here, buddy. Okay, so the only problem is William has hair covering his forehead. So why don't you lift up your hair, lift it up, and then we're going to get close. Perfect. So this is going to grow in Celsius, so 37.4, which is not having a fever. Okay, if I shoot something that's warm, like my cup of Starbucks coffee here, it's going to give me a label of high. Now, the thing about my coffee is that it's actually outside of the physiologic range for humans. So this is not going to give you a temperature per se. But if it was, say, someone who had a fever of, by the way, 38C equals 100.4F, then it's going to give you the temperature in Celsius. And anything above 38 is going to have an alarm like you just heard there, and that would be someone who is technically having a fever. So we can switch it over to Fahrenheit, but its default is Celsius. It really is just designed to screen out those patients that have a fever. You can just record what you have down in Celsius, and we're in good shape. Awesome. So there you go, a little bit of an example from home. One other thing we'd like to talk about with the COVID-19 screening that I failed to mention is if you have a patient that presents to, or anybody that presents to the office, and they're having respiratory distress or coughing or sneezing or something like that, we have masks that are available at the front desk, and we're going to ask the patient to put that on. Many of our patients are presenting with their own masks, and that's perfectly fine. But if you do have that, please know there are masks available right at the front desk. You would have them put that on immediately, and those individuals we're going to ask to leave. They're not the only people we're going to ask to leave, unfortunately. We can't have additional people accompanying our patients. So if there's someone who perhaps was the ride, they're going to wait in their car. The only exception for that would be if we have pediatric patients or minors where the parent wants to accompany. Now I said parent singular, and certainly we aren't going to have a number of children accompanying a parent accompanying their child like we have had in the past. So our whole goal is to be very strict with the number of people we have coming into the building and keeping everybody safe. And this goes, not only are we keeping ourselves safe from our patients, but in this case, we could be keeping our patients safe from our providers and staff. Additionally, we have to follow up with our patients. So patients who've been treated should receive a follow-up contact 48 hours after the visit. And this is for the following reason. If that patient became COVID-19 positive or became a presumptive positive case, the staff involved in treatment will require quarantine assessment. So that just means that if we've treated a patient and that patient then goes on to develop symptoms of COVID-19 in a particular window, that we would have to evaluate the staff involved that came into contact with this individual and determine if a quarantine for 14 days is required. So this concludes our first video. Thank you very, very much. I hope that this has helped to answer some of the questions that you have and is an exercise in just getting used to this format. We'll be putting more of these informational pieces out to you, trying to keep them a little bit shorter than this. This one was a bit longer because of the algorithms. But thanks for your time, and we look forward to seeing you all again very soon.